Hey guys, so in today's video we're going to talk about things not to expect when you're being hospitalized for pneumonia. Before I begin, I'm not actually a doctor, so I may say things from my own experience with pneumonia. Like I experienced pneumonia twice, once this year, now once again this year. So yeah. So what is pneumonia? Pneumonia is an infection of the lungs which causes the alveoli to fluid, which fluid mucus includes filled with the fluid mucus and pus. Like it just makes the alveoli get inflamed. So one of the causes of it causes are streptococcus, influenza virus, fungi, and cancer, such as lung cancer. And I don't really know that much then why lung cancer causes pneumonia, but the reason would be it just decreases your immune system, which makes you susceptible to such infections. That's why lung cancer patients always get pneumonia, like, frequently. So bacterial says because of pneumonia, like streptococcus, and coccus, other bacteria, etc. And food bacteria, especially when they get into your lungs, the trachea, and that condition is called aspiration. And if it's pneumonia, then that's called aspiration pneumonia. Pneumonia is also caused by viruses such as influenza or common flu. So what are the symptoms of pneumonia, and is it curable? The symptoms of pneumonia are fever, chest pain, uh, shortness of breath, rapid breathing, tachycardia, fatigue, cough that is yellow or green and brown, with mucus blood. I don't know why blood, but mucus blood, plus fatigue, you mentioned that, lightheadedness, headache, not bad at all, not bad at all. Oxygen level being not 93, or like not 91 to 94, which is pretty abnormal. It's also fast heartbeat. So is it curable? Yes. Pneumonia is curable, it just depends. It depends on the person, his age, body, and condition. Sometimes there are also types of pneumonia, which is community acquired pneumonia and hospital acquired. Hospital acquired pneumonia is caused by, I think, caused by being in hospital for a long time, and hospital acquired pneumonia is actually hard to treat. It might be a bit antibiotic resistant, so which is why it is hard to treat. So pneumonia, anyone can get pneumonia, even the teens, kids. The majority of those who get pneumonia are the children and the elderly. Teens get walking pneumonia. I think they do get general pneumonia, walking pneumonia here. So what are the treatment of this disease? While fluids, rest, antibiotics if it's caused by bacteria, antiviral, antifungal if it's caused by fungi. I don't know the name of the fungi which causes pneumonia, and I don't know if doctors would prescribe antiviral medicine for viral pneumonia. Although viral pneumonia can get away on its own. So when to get hospitalized with pneumonia? Well, if you have these symptoms like extreme shortness of breath, fast breathing, extreme shortness of breath, skin turning pale, fingernails turning blue, lips turning blue, and cold hands and feet, fast heartbeat, extreme sweating, excessive coughing. If you have all the symptoms, then it may time to go to the hospital. Also, if you have vaccinated and you saw it showing 88 SpO2 or 89, that means time to rush to the hospital. And don't delay when you have the symptoms. Don't ignore. If you're gonna ignore the symptoms, then it means you're killing your own self, so don't do that. Just rush to the hospital or call 911 or whatever the emergency number for the country is. And if you have called an ambulance, and ambulance may take a while or minutes to come, so during that time, make sure the patient is in a area where there is much ventilation, like aeration, like all the windows are open and the fan is turned on at high speed. So how can you prevent pneumonia? Well, to prevent pneumonia, get enough sleep. If you don't get enough sleep, then it may compromise your system, which may make you, which puts at risk of developing such infections. Get enough sleep and take a rest. Try to reduce stress. Eat healthy, like foods that have high nutrients. Wash your hands. Wash your teeth. And cut your nails. So I try to keep the hygiene. Keep hygiene, then you will be at risk. Also, don't touch your nose, eyes, and mouth. Also, stop smoking. Avoid smoking, cigarettes. If you're smoking cigarettes, then quit that habit. So, there are things not to expect when you are being hospitalized for pneumonia. Number one, you may feel like that you just only have to stay in the hospital for 3 days. Actually, it's not 3 days. It just could take up to a week or more than a week, 2 weeks or even a month, depending on your condition and your age. Number two is you feel like you put the oxygen mask on, then your shortness will then your shortness of breath will completely go away. You're gonna breathe normally. Well, actually, when you're gonna put on the oxygen, you're still gonna have difficulty breathing, but you'll feel much easier to breathe than how you were feeling before. Before, it will make you easier to breathe. It will make it easy to breathe, but not necessarily with pure shortness of breath. Pure shortness of breath just need medicine, and doctors I think may prescribe like steroids. It is the hydrocortisone, and it is used for really for shortness of breath. Like is used to make it easy to breathe. Sorry for my bad grammar. Number three, you may feel like oxygen will cure the coughing, or like will clear the lungs. Or actually you're wrong. It will not clear lungs, don't completely cure the coughing, but it will make you feel better. And to clear our lungs, you will need nebulizer to clear our lungs and cure coughing. Also antibiotics and other medicines to stop coughing and cure coughing. Then number 4 is you might feel like after some hours being under oxygen, you might feel like you take it off and try to adjust with oxygen. Present in nature like 100% oxygen. Actually, don't do this. Don't do this too early. You still need oxygen, and your doctor will tell you when to like take off the oxygen mask off and try to start the rehabilitation with normal oxygen. And I think number 5. Number 5. I think this ended at 4, or I think number 5. Okay, now I think this ended at 4. So whenever I start with like on antibiotics, then if you see like it's working and your symptoms are starting to go away, I feel like that you shouldn't worry and be concerned anymore, since antibiotic is working, which is a good sign. It's a sign that you may recover from pneumonia. So that's why I feel like you don't worry. Okay, number 5 thing not to expect is you feel like after getting fluid from the lungs through injection, you feel like the irritations of your breath is not gonna go away. Well, actually, it will not go away. Since I think fluid is gonna be still present in the lungs inside the alveoli. To remove the fluid from alveoli, you will require antibiotics and other medicines. So there are also vaccines to prevent pneumonia. Anyway, I think that's pretty much it for the video on that what not to expect when you are being hospitalized for pneumonia. Thank you guys so much for watching. Please make sure to subscribe and leave a like on this video. Bye. Also, what I forgot to mention that some might feel like that they're gonna get out of the hospital, like no, like they're gonna get out of the hospital energetic. Well, actually, it's not like you're just gonna leave the hospital energetic. You're still gonna have fatigue. Like people actually leave you fatigued. Why? During recovery, you can feel tired and very irritable and anxious. It's just gonna make you feel tired. So after getting discharged from hospital, you may start to feel tired, which may go away after a week, or this might take many months to go away. So yeah.